Okay, in this video I'm going to discuss the parts of the humerus. Humerus is a pretty complicated bone. It's got structures built up at the proximal end for forming the major shoulder joint, and then at its distal end it's got some structures that are very important for forming what we call the elbow joint. Okay, so we'll work proximal and then we'll work our way down distal to the elbow. Okay. First thing that should be very evident with the humerus is this nice rounded head. Okay, it has a nice round kind of ball shape to it, which is nice because it actually fits into the socket of our scapula that we talked about in the scapular video to form what we call a ball and socket joint.
Now, the easiest way to determine if you're looking at the front or the back of, or the anterior or the posterior side of the humerus is to look at these two depressions on the distal end of the humerus. Okay, notice on the anterior side, the depression is not nearly as pronounced as it is on the posterior side. The posterior side has a very pronounced depression, and we'll talk about that in just a little bit. So that lets me know that this is an anterior look at our humerus. Okay, so this just happens to be a left humerus, and I know that because, you know, if it's facing away from us, this is how it will go, and because this has to point forward, and the head is always going to point medial. Okay. Kind of opposite of the head, pointing lateral, will be this little bump here. We call that the greater tubercle. Greater tubercle is going to point laterally, whereas the lesser tubercle is going to point more anteriorly, pointing forward. And then in between those two is this groove right here called the intertubercular groove. Once again, inter would mean between. And if I work about a third of the way down the bone, you'll kind of notice that there's this kind of, and it's not super pronounced, but there's just kind of this rough projection on the lateral side of the bone. We call that the deltoid tuberosity, and that's where the big deltoid muscle in our shoulder is going to attach, which, like I said, it's about a third of the way down. If we work down finally to the distal end, where we are going to see the elbow joint, we're going to look at the structures anteriorly, and then we'll look at them posteriorly. First things I want to point out are these epicondyles, the very, very pronounced medial epicondyle and the lesser pronounced lateral epicondyle. Those are bumps that point out towards the side, very important for the attachment of two ligaments that attach to our forearm bones. Okay. As I was talking about earlier, there is a depression on the front side. We call that the coronoid fossa. Okay. It accommodates the coronoid process of the ulna, which is going to articulate with this structure of the humerus, which we call the trochlea. Okay. The trochlea is very important. The ulna will kind of wrap around it, and the ulna has kind of this U shape to form our major elbow joint, the humeral-ulnar joint. Okay. This kind of more rounded bump over here on the lateral side is called the capitulum. Okay. And this is going to articulate with the radius to kind of form a lesser elbow joint, the humeroradial joint. If I flip it over, okay, once again, this very deep depression is what is very evident on the posterior side. We call that the olecranon fossa, or olecranon fossa, which accommodates the structure on the ulna, called the olecranon or olecranon, depending on how you want to pronounce it. Very important. This actually will help lock our elbow in place when we extend our elbow out. So very, very important structure. Okay. Once again, you can still see the trochlea. The capitulum is kind of lesser seen in the posterior view. You can still definitely see that medial epicondyle, and you know, you can see pretty well the lateral epicondyle. So that kind of wraps up the humerus.